Today's date is November 2nd, 2017. This is Rhonda. Hi, Rhonda.
Hi.
And Rhonda initially entered our office in June for back complaints related to a car accident. And we began the journey together correcting those issues, and Rhonda was making nice progress with that. And in August, we started discussing doing some lab work on other health concerns that Rhonda was suffering from. Rhonda, would you like to share what some of those complaints were, and along with your back complaints, kind of how severe things were and how you were feeling before we started any type of treatment?
Okay. From my car accident, I had pretty good whiplash, so my neck would not turn. It was pretty much frozen with not much turning ability. My back was pretty tight. Constant headaches, and then all the other symptoms that I had not from the accident, I guess I basically blamed on menopause, which I'm finding out is probably mostly due to my hypothyroidism / Hashimoto's.
Autoimmune condition.
Correct, yes. And so I had a lot of depression, anxiety, stress. I couldn't cope. I had a lot of short-temperedness. I didn't like myself or anyone else around me. Just in a sad place. A lot of pain, joint pain. Besides, the accident pain, knees, fingers, elbows.
How old? I'm curious. How old would you say you felt
I
prior to
felt
starting?
probably 70.
You felt like you were in your 70s.
Yeah.
Yeah. So it was painful.
Yes.
Yeah, both emotionally and physically. Is that accurate?
Correct. I would get home from work and collapse.
Because
all
of
I could do.
fatigue.
Correct.
So you were barely able to kind of work your day and then finish and
just-
get home.
Yes.
So in August, then we decided to do some lab work, and we did a blood chemistry test. We did food sensitivity testing. We evaluated to see nutrient-wise where you were out of balance and low and deficient. And so would you like to just share what you discovered and kind of what the journey has been and where you're at this point?
Well, I know I was deficient in quite a few areas, so we supplemented all of those. The food thing, I had some sensitivities, but not as much as a lot of people. But went on the whole gluten-free, dairy-free, sugar-free, alcohol-free, caffeine-free diet, and it has changed my life.
A 4-day rotation, right?
For the most
food
part.
elimination and
Yes.
a rotation diet plan.
Yes.
Yep. And kind of what's transpired then?
I've gotten energy back. My mood is completely different. People say it to me, my mother especially, because she's around me every day. My knees don't hurt regularly anymore. My fingers aren't just pounding. My whole mood has changed. I've lost 15 pounds. Not that that was part of my thing in the initial, but that's okay too. Nice side effect.
How about energy?
Completely different. I actually find myself loping instead of just walking sometimes now to the car.
How about in the evenings? Do you feel like you just have to collapse?
No, I come home, I do the dishes, I walk my dogs, I cook every day now.
Whereas before you couldn't.
I just had no energy to even cook supper.
Wow.
We ate out all the time because I was just done.
So I'm curious, what % improvement would you say you've had in this, 8 to 12 week period of time after you've started your program, changing your diet, really taking better care of yourself, changing your stress, right?
Yes, I've changed my stress.
Some major, you're a small business owner,
Yes.
and so you've made some significant changes there. So 0 to 100 compared to where you were when you came in, what level or % improvement would you say you've made?
I'd say 85.
85%. That's a nice change in 3 months.
It's big.
That's drug-free, correct?
Drug-free.
Drug-free.
Well, except for my levothyroxine.
Yes, but I mean, other than that,
Yeah.
you're
Just
not on
supplements.
anything. Yeah, nutrition and your diet.
I take no more pain pills, no acetaminophen or anything. Just a little turmeric once in a while.
That's awesome. Do you have any advice for future patients?
try this system. um, it has changed my life for the better.
Did it surprise you?
Yeah.
Were you expecting
Not
this
this
kind
much.
of improvement
Not
in a
this
3-month
much.
period of time?
No, I was kind of a skeptic.
You were a skeptic?
Very much.
Okay.
The whole gluten-free thing, I was like, yeah.
Okay. Well, thanks for being honest about that.
It was. I thought it was a bunch of baloney.
Sure.
So.
So, thank you for that advice. Will you give me permission to share your story with doctors, students, patients, anywhere?
Absolutely.
Any restrictions on that?
No.
Rhonda, I am so proud of you. You've worked hard for 3-4 months and it's paid off. And I honestly don't believe you've peaked out in your level of improvement. I really don't believe that at this point. And the 85% is wonderful. I think it could even maybe be 95%. So stay with it. Keep working hard.
Thank you.
Great job.